And here's thoracic vertebra. That's the next region down. There's 12 of these. And like I said before, the ribs articulate here. I've got 2 that are joined together. And I'll take advantage of that fact and I'll point out this feature. This is called the intervertebral foramen. And that makes complete anatomical sense. Inter, between the vertebra, foramen. Foramen means hole. And as you might surmise, this is where the spinal nerves pass through. So those attach to the spinal cord, and this is where they can pass. There's afferent and efferent information along a spinal nerve, so information going out to the body or information coming in, and that's where that spinal nerve is. All right, but let's take a look at some other features. Now, one thing you'll notice, I'm going to get cervical vertebra here. Yep. So one thing you'll notice is that the centrum is larger. And we'll find that as we go down further and further. The centrums get larger as you go inferiorly along the human body, and it makes sense. They're supporting the weight from what is above it, and as you go further down, they have to support more and more weight, and so the centrums get bigger and bigger and bigger. It's kind of like sections in a trunk of a tree, where in the top, the tree is more narrow, and as you go further down the trunk. All right, sorry that last video cut out. My iPad had to give me a message. Okay, so here we are taking a look at this thoracic vertebra. And let's take a look at things that we already know. There's a centrum or body, there's pedicle, there's lamina. And this is the superior articulating surface. It would be this way on a person, with a person facing to your left. So superior articulating facet, and then the inferior articulating facet, you have to look kind of underneath to see it, but you'll see a flat surface. You can kind of tell that something touches up against that. So superior, inferior. One thing that you can see very obviously in thoracic vertebra are these structures, and those are transverse processes. The ribs will be articulating with them. That's not their only articulating place, but that's one of them. And among all the vertebra, this is where the transverse processes look the most robust. I think of them as kind of like a thumb sticking out. And you see indeed that there is a surface there on the end. So while this whole thing is called the transverse process, this is called the transverse costal facet. Costal is in reference to ribs. You'll see that word a lot in reference to ribs. So costal. For instance, the muscles in between ribs are called intercostals. So transverse costal facet here and here, just that kind of rounded, flattish surface. But then again, this whole thing is the transverse process. There's the lamina again. Here are the spinous processes, our neural spines, and you'll notice that compared to the cervical, they look a bit different. They're longer, they kind of lean down, they lean inferiorly, and we'll be learning about muscles that attach to those that are important in, say, the flexion and the extension of the spine. This is that intervertebral foramen again, just the regular vertebral foramen there. But then let's take a look at another place where ribs attach. You notice when you take a look right here, on the top of the centrum here, you see a little bit of a flat surface there. See another one here, another one here, another one here. And let me see if I have another. Yeah, here's another thoracic vertebra, and you can see there's kind of this little ditchy surface, and there's a little ditchy surface. Those are called costal demifaucet. The word demi means half, and so it's kind of half of an articulating faucet. And let me explain that. You see that when you have two vertebrae together like this, it brings the surfaces close together. There's a demifaucet, and there's another demifaucet. And just a second, I'm going to get a rib. Okay, I got the rib now. All right, so I'm going to be looking at this side. A little bit of this kind of clay that I use that to keep these together. But you can see that there's a little bit of a surface there, a little bit of a surface there. And then let's take a look at this rib. Now, the rib has two main parts to it when you're thinking about these articulating surfaces. And here, this is called the cap or head or capitulum of the rib. I usually refer to it as the capitulum. It's maybe a little bit too bright it's having trouble focusing on it. Maybe let's see. But this capitulum has two main surfaces on it. There's a little bit of one here and a little bit of one here. It doesn't like to focus on that. It's just too small a thing to focus on. It wants to focus on the rug instead. Just kind of put my hand next to it so it focuses right. So there's a little surface here, a little surface there. Now, let's bring in the thoracic vertebra. So the capitulum touches up against the pair of those costal demifaucets. So here, there. And then there's this other part of the rib, and this is called the tubercle or tuberculum. That's a bit of a general term. We'll see other tuberculums and tubercles. So it touches here, and then the tuberculum touches up against the transverse costal faucet of the transverse process. And so that's how it articulates. I'll show it to you in this angle. This one, and touches up against that one like that. And so the person ends up kind of looking like that with that rib attachment there. Now, just to complicate things, not every thoracic vertebra has their rib articulating surfaces exactly like what I explained. All of the middle thoracic vertebra are like that, but when you get towards the end, this is taking a look at one of the very last of the thoracic vertebra, and you can see that if you look for demifaucets, and I'm sorry, this is kind of has a lot of this glaze on it, but instead of seeing a surface like here and here, you see this kind of ditchy part here, and it's right in the middle here as we look on this lateral side of the centrum, and you see it kind of like that. So instead of a demifaucet, that's a whole faucet. And these later thoracic vertebrae are like this. These are the ones that hold the floating ribs. And the floating ribs don't articulate on a transverse process. And they don't have robust transverse processes. Actually, they're a little bit broken off of this one. There would be a little bit more on this side. So it's not like these thoracic vertebra that have the real robust transverse processes. So This is a thoracic vertebra. You see that? It is a bit different. And let me show you another one. Here, this guy. That's another thoracic vertebra. And this is the first one. And I think still distinctive is that spinous process. The superior and inferior articulating surfaces are pretty large. They allow for a lot of touching between the two vertebrae. And but you do get a sense here that the centrum sizes are a bit different, but this is still thoracic. This is the next. These are vertebrae from the next region down. These are lumbar vertebra. We have 5 of them, and you can tell even just from these 2 how different they might look. Now, there are some things that are distinctive about lumbar vertebra. So they have a transverse process. And you know what? I'll show you cervical. These guys even have a transverse process, but it's just this tiny little thing sticking out. So not much of one. And we know that with the thoracic, they have very, very distinctive and thick transverse processes. And then when you look at lumbar, not so much. Let's get the other guy. Okay, here. So, kind of thin. That's something you would stick a rib on. And then when you take a look at the superior and inferior articulating surfaces, they have a bit of a different shape to them. In that for the articulating surface, the superior and inferior articulating surface, it kind of has a curve to it, kind of curves inward. I think of it as kind of cupping your hands like this. And here you can also get a sense of this, that it's a bit slanted here. And then when you look at the inferior articulating surface, it kind of matches like that. It kind of, the flat surface kind of faces outward laterally. And then this is taking a look in this other one. So this obviously is one that's lower. It's just getting towards the sacral vertebra, and this is one that's a little bit more superior. So this is taking a look at actually the very last thoracic vertebra. So I've shown that to you before, and it has this inferior end that looks very lumbar-ish. And what do I mean by that? That's with these inferior articulating faucets, and they kind of face outward. They face laterally, the flat part. And but then with this last thoracic, when you take a look at this superior articulating facet, it's very flat, very much like what you expect with other thoracic vertebrae. This is the way that they would fit in together. This isn't perfect. These aren't coming from the same person, but they kind of set inside each other like this, which is different than thoracic, where they are just immediately right on top of each other. And here they sit inside each other with these superior articulating faucets. They kind of cup inward. And so what they're able to do is allow for a lot of flexion and extension of the spine. They actually prevent a bit of rotation. More of your rotation actually comes from the thoracic region. I can't really show this well. I mean, one thing to note is that there always be intervertebral discs in between these bones, and that's not something that I can show you right now. I just have the bones. So, but rotation is this kind of twisting motion, and that actually, most of your rotation comes from the thoracic region, but you can't get a lot of flexion and extension, kind of hunching and arching your back. That doesn't happen in the thoracic region. The ribs can't crash into each other. And so other parts of the lumbar vertebra, they have the pedicle, they have the lamina, they have the neural spine or spinous process. Here it's all just kind of very short and stubby. Let's see, look at this big one again. And you can see how it's kind of this short and stubby with a very, very large centrum. And then here is the sacrum, and that's the, like I said before, the combined sacral vertebra. There's 5 of them here, and you can see you can see these separate 5 bones. These would be the transverse processes. You know that they kind of come out here, and what's missing here is the pelvis. So there would be a bone of the pelvis called the ilium, and the kind of modified transverse processes of the sacral vertebra would be fused. You would have the sacral iliac joint. Actually, I shouldn't say that it's fused, but there would be a joint that doesn't allow a lot of mobility there. And so this rough edge is where the ilium is. With the sacral vertebra, they do have foramens here where the it's really branches of the spinal nerves. The spinal nerve kind of comes out and then it splits and into different, what's called ramus, rami, I guess is the plural. And so what we have here is what's called the anterior sacral foramen and the posterior sacral foramen. So all you have to do is just know anterior from posterior for those. And then these are our tiny caudal vertebra. So people have more than these. One might have broken off in this articulation, but these caudal vertebra can fuse together and attach to this very last sacral vertebra. And those fused caudal vertebra is called the coccyx.